Hello, I'm Matt Schwartz, Chair of the Mayor's Healthy Hometown Worksite Wellness Committee. I'm here with Tom Hudson with InthWorks, and we just finished up a quarterly CEO Leader Roundtable. And so, Tom, you came this morning to kind of share the story of InthWorks with regard to healthcare. So, what's the kind of quick recap of where you all evolved, how you evolved into this place
Well,
that you are?
I think we've been doing this now for 5 years, and we did it out of a need for survival for our business because healthcare costs were going through the roof. And so we started down this path of figuring it out as on our own. And we've learned a lot, and we've made a lot of mistakes, but we think we've made some real progress. Now we have a program where we're actually making a positive impact on our costs, and the way we're doing that is by getting our employees to be healthier. And the way we're getting that to happen is by employing a full-time nurse that spends time with those individuals that are sick and coaching them on what they need to do to get well. And starting all the way from something as basic as you need to have a primary care physician. So it's putting those together, figuring out from the biometrics about what's going on with that individual. This nurse, by the way, does not work for InthWorks. She's an employee of Baptist Health Network, and Robin is working with these individuals to get them on a better path so that they can have a better idea of how to take care of themselves. Again, it comes back to personal responsibility. You're responsible for your own nutrition, you're responsible for your exercise. Take responsibility for your health care.
We talked a little bit, like you talked about the fact that it was instigated by cost, but really the way that you approached it was a little different because people might have pushed back, and we had some examples where people did push back, but we talked a little bit about kind of the why, and if you'd share a little bit about that.
When we started, you're right, Matt, it was driven by cost, a 50% increase going from 2006 to 2007. But the way we approach it is the way we approach problems in manufacturing is what's the root cause of the problem. And when you get to the root cause of the problem, it turns out to be for most people, it turns out to be nutrition and exercise and working diligently on those things. So we approached it as working with individuals about fixing their health care, not fixing something, getting them to be healthier, and how much more enjoyable life will be if they're not going to the hospital every 3 months.
Right.
And so the focus was about the individual and not cost. And by keeping the focus on the individual, we've made progress with individuals getting better, and the result is lower costs.
So, if there's a CEO out there, who doesn't necessarily want to go through the 6-7 year painful path,
Yes.
what would be the?
Come see me in 15 minutes.
Yeah, I was going to say, what would be the? Hey, here's the 2 or 3 things that come to my mind that I learned. Here's how I would start.
Yeah, that's an interesting. I've not thought about it that way just because I've been living it for 5 years. But clearly, to get the associates involved and start working to help them provide the resources. And one of the key lessons I guess I've learned is it's interesting for you and I to talk to any of our associates about their health care, but they have very little respect for what I know about, as they should probably, about healthcare. So they tend to ignore anything that comes from anybody who's not a medical professional. So a doctor or an RN, if you walk around with a stethoscope, people pay attention to you when it comes to your health. The fact is, the medical profession, they may not know much about wellness and health because they didn't get that training. But that's where they have to learn. So first, it's figuring out how to get healthcare people that are respected by the associates who know about healthcare, focusing on them, and then putting programs in place. And we happen to be advocates of a whole foods, plant-based diet, and we're pushing that for those people who really need to get some help on the chronic diseases. And it's working. And as soon as it works for some, then there's word of mouth like anything else, and all of a sudden you've got some momentum going to it. And we're having people that are discovering they have diabetes. A couple of people saying that the program saved their lives, literally. Weight loss, all sorts of good things are happening as a result. result, but medical involvement has to be part of the equation.
And you did. I mean, to be fair, I mean, at the very end, I mean, you said having gone through all these iterations, you now have seen a change in your trend. I mean, this past year, you saw some reduction in cost.
Yeah, and we hope for 2013 will even be more dramatic. So we have a pretty good answer. It's like everything else, continuous improvement, and so you can't turn your back on it.
And
it's a huge cost driver, as everybody knows.
Absolutely. And you'd also shared about the advantage of that nurse. I mean, you've got a relationship, and then there's some consistency to start to build habits with people.
Yeah, and that's, what Robin's providing is what most doctors don't provide, and that is this personal involvement. She's meeting with people who want to be working with her and spending whatever time she needs to spend to get them to understand the physics of what's going on. Right. And as soon as people get that and understand that Robin's truthful and she cares about them, she's because she's not an NthWorks employee, she's not sharing any data with us. And Robin and I have our discussions. We talk about person 1 and person 2 and person 3,
right?
Not individual names. So it's that trust that gets built up between that medical professional and somebody who needs help, and it's the repetition of seeing her that's making the progress.
Well, thank you. This has been great. It was an enlightening conversation, a lot of back and forth, and certainly you're invited, if you haven't been lately, to our quarterly roundtables. We've been doing it at Baptist East Milestone, and we talked about this morning. We may start going out on site, so we look forward to seeing you at one of our next sessions.